1 in every 5 students experiences a mental illness in a given year. At a school the size of Ohio State, that's over 13,000 people. Of these students, 25% have what is categorized as a serious mental health illness, like severe bipolar disorder or obsessive-compulsive disorder. Yet, only 20% of the students in need of mental health services actually receive them. Half of mental health illnesses begin by the age of 14, and 3/4 by the age of 24. But intervention doesn't occur for an average of 10 years after the onset of symptoms. These statistics, alarming in themselves, become extremely detrimental when we consider the recent suicide rates. From 1998 to 2018, the suicide rate increased 35%, from 10.5 per 100,000 to 14.2, leaving suicide the second leading cause of death for ages 10 to 34 and the 10th overall. Of the around 800,000 who die by suicide around the world every year, 90% had an underlying mental health illness. It's easy to say that you probably know someone who has been personally affected by suicide or mental illness, perhaps many. For me, I first encountered this in the 8th grade when my close friend attempted suicide and wrote her suicide note out to me. After that day, I was faced with a variety of unfamiliar challenges. I didn't understand mental health illnesses, let alone how to deal with suicide. Luckily, my friend was able to get the help she needed, but after being exposed to the shortfalls of mental health awareness and suicide prevention in my school, I was motivated and determined to address the issue in my community. After working with multiple organizations in Cincinnati, I had heard many stories, and I learned a vast amount about the importance of personal mental health and a positive mental health community. A culture of poor mental health has a broad impact. It creates extensive social and economic costs. These costs impact different sectors including healthcare, business, education, law enforcement, criminal justice system, and emergency and social services. However, much of the economic burden of mental illness is not at the cost of care, but the loss of income due to unemployment, expenses for social support, incarceration, and a range of indirect costs due to these chronic disabilities that begin early in life. Additionally, there are various ways in which poor mental health has been shown to be detrimental to physical health. People with the highest levels of self-rated distress were 32% more likely to have died from cancer. Depression has been found to be associated with an increased risk of coronary heart disease. Schizophrenia doubles the risk of death from heart disease and triples the risk of death from respiratory disease. This is because people with mental health conditions are less likely to receive the physical health care they're entitled to. Mental health service users are statistically less likely to receive routine checks, like blood pressure, weight, and cholesterol, that might detect symptoms of these physical health conditions earlier. Poor mental health can also increase the risk of other negative lifestyles and conditions. Those who suffer from mental illness have higher rates of alcohol, tobacco, and drug use disorders. Data also shows high rates of comorbid substance use disorders with anxiety disorders, which include generalized anxiety disorder, panic disorder, and post-traumatic stress disorder. People with mental health conditions are not as likely to be offered help to give up smoking, reduce alcohol consumption, and make positive adjustments to their diet. Suicide is a global issue. In fact, 75% of suicides occur in low and middle-income countries. Suicides are most prominent in Asia and Eastern Europe. Lithuania has the highest suicide rate among the countries for which we have data, with 28.6 suicide deaths per 100,000 people, followed closely by South Korea with 26.3 deaths per 100,000 people. With the current global pandemic, mental health climates are rapidly changing. Increased isolation and online communication are presenting even greater risks and hardships to those with pre-existing mental illnesses and to the personal mental health of those without. Multiple cases of COVID-related suicides in the US, UK, Italy, Germany, Bangladesh, India, and other countries have been reported in mass media and psychiatric literature. Following the reinstatement of strict lockdown laws in Australia, increases in the suicide rates have become alarming. As of August 6th, there had been over 1,200 suicides since March, compared to just over 200 deaths with the virus. This disproportionately impacted adult men, school-aged children, and frontline healthcare workers worldwide. There are many facets to understanding suicide rates and mental illness trends. Experiences vary based on age, gender, race, socioeconomic status, nationality, urbanicity, and more. There's no easy answer to preventing suicide or improving mental health awareness and care. It will take the ideas and drive of many willing to tackle individual aspects of the issue. Maybe it's addressing the causes of adult male mental illness rates in Japan. Maybe it's improving emergency room suicide screenings for adolescents in America. Or maybe it's making therapy and mental health care more accessible to lower-class families. Whatever it is you choose to address, you can do your part in improving the mental health environment worldwide.